Welcome to another Toma Memorial Hospital Health Check 360. We have Tim Kortbein and Emily Wall here to talk about a worldwide patient outcome program called Focus on Therapeutic Outcomes, or FOTO for short. Well, welcome, Tim and Emily. It's great to have you.
Thank you.
And your expertise in rehabilitation.
Thank you.
So, Tim, let's just start with you. Can you give us an overview? What is FOTO and how does that impact patients and what you're providing the care for patients?
It's a functional outcomes database that allows us to track function through the course of therapy.
Okay. And so in rehabilitation world, what does kind of that going to be talking about if you're coming in for rehab or so maybe I'm just asking for a general, what is rehabilitation?
So what is rehabilitation? So rehabilitation is kind of an umbrella, and we have physical therapy, occupational therapy, and speech pathology in our department. So all of those are in an umbrella under rehabilitation. So those are the services. Yeah.
And we will measure function if they're limited in daily activities and then how much they can improve.
Okay, so I might need to be rehabbed to be able to walk in my kitchen because I broke my leg.
Yep.
Right.
Or I've had hand surgery and now I can't cut with scissors, I can't hold a pencil. Got it.
Yes.
So what are you finding out from the data? Maybe, Emily, you can talk a little bit about women's health.
Yep, I can talk. So what we do when we measure the data is to try to see how are we doing against other people around the entire world. So there's tons of people that are in this database that have been collecting data for years.
And this is really focused to rehab data.
It is rehab data, yep. And so we benchmark it in each different category about what we're doing. And so for women's health, we're looking at people with incontinence, and we're seeing like how quick can we get these patients better compared to other people doing the same thing. And what we found for us is that we can get patients better or in 3 to 4 visits versus 8 visits internationally. So
you are really cutting the time in half.
Yep, number of visits is cut in half.
That is so significant. I mean, that is just incredible, because it really means that whatever you guys are doing, you're doing it really, really well, and you're doing it better than most everybody.
Right.
Yep.
What is it that you guys are doing so great that you'd have that kind of data?
We have great staff and very individualized care. We give staff the time they need to really focus on their patients. So and that really makes the difference.
That provider to patient, that worker, is so critical.
It is really important, yep.
What have you guys, I'm just kind of throwing this out there, what kind of feedback are you getting from your patients about their services?
Well, go ahead, I'll let you talk.
They're very pleased with the services. They like that we use technology to track their outcomes.
So they
and
can see their progress.
Yep, throughout the course of their visits. And that the therapist looks at this data to really individualize the care.
Okay.
Yep.
Now, you've got some data. Can I read your data on the vertigo?
Sure can, yeah.
So right now, your vertigo patient outcomes are placed in the top 15%. So that means like from a 4 to about 5 visits compared to 7 visits for peers internationally. That just stood out to me because I have some people that I work with that have had vertigo, and you don't want to have vertigo ever.
No.
Sure.
That is so significant.
Yep. And so we have great technology to help us to evaluate those patients, and we have really well-trained staff that they do an excellent job in treatment. And whenever we have problems too, if you have questions, we have great staff and good camaraderie to do teamwork together to try to get the best outcome for every patient.
It's really working for you guys.
It is really working, yeah.
The other side benefit is less visits, you have less co-pays and less to pay toward your deductible.
And you have more time to be healthy.
Yes.
Right.
So last 30 seconds, where could viewers find more information about services?
tomahospital.org.
Okay, tomahospital.org. Thank you so much for joining us, and congratulations on your great data. That's amazing.
Thank you.
It's a tribute to your services, what you guys are doing there.
Thank you.